Well, let's get back to the coronavirus situation. Israeli Health Minister Yuli Edelstein said Tuesday that Israel will be holding discussions with Russia. That's after President Vladimir Putin announced suddenly that his country would start using a coronavirus vaccine that it has developed, becoming the first country in the world to do so. Well, Israel will first check whether the vaccine is genuine, Edelstein added, perhaps reflecting worldwide skepticism that it has not been tested enough. Our senior international affairs correspondent Owen Alterman takes a closer look at that Russian vaccine.
A vaccine that may not help, and a public relations strategy that may not work. In the big announcement Tuesday morning, Russia saying it has gotten there first.
As far as I know, this morning, for the first time in the world, a vaccine against the new coronavirus was registered.
Russia's Gamaleya Institute has named the vaccine Sputnik V, casting the vaccine as the heroic successor to the original Sputnik, the 1957 Soviet satellite that was the first in human history launched into space. Pressing home Russia's public relations point, we are first, and the vaccine is safe.
I know it works fairly effectively, forms stable immunity, and, I repeat, it has gone through all the necessary checks.
Critics of the vaccine, and there are many, do not agree. They say the vaccine may not be safe. It has not gone through phase 3 trials of thousands of people, meaning it's not known whether the vaccine causes harsh side effects that could do more harm than good. Here, the Russians may not be overselling. A scientist Tuesday on the state-run RT television network admitted the risks, but suggested that fast-tracking the vaccine is the best way to save lives overall, balancing the risks of the vaccine against the risks of the pandemic. Experts and media outlets around the world are not convinced, such that internationally Russia is getting no boost to its image. Sputnik V is not yet truly something that's out of this world.
And joining us now from New York is Peter Pitts, former Associate Commissioner for the Food and Drug Administration, the FDA. Thanks for joining us, Peter. Well, I have to just ask you, what do you make of this Russian announcement that they've developed this vaccine?
Well, there's no data, there's no science, there's no transparency, so I don't give it much credence whatsoever. It's kind of throwing a Molotov cocktail into the COVID-19 conversation. You know, Russia has not been a part of the global cooperative effort to fight the pandemic, to develop a vaccine. Its vaccine is not even mentioned as a phase 3 product by the WHO. You know, I think I'll paraphrase another Russia skeptic, Winston Churchill, when I say that the Russian vaccine is a riddle wrapped in a mystery inside an enigma. They tested it with soldiers. That's not ethical. I simply have no faith that this is a real deal proposition.
Right, but on a practical level, of course, every option has to be explored. What should the United States do specifically, practically, with that announcement?
Well, there's only one thing that the United States or Europe or any country could do, which is demand to see the data generated by the scientists that developed the vaccine. And if it can pass muster, that's fabulous, although I have my doubts. But right now, what we need is data. We need transparency. We need cooperation and partnership, and that's not what we're getting.
Right. Now, Pete, I want to ask you, early in the program, we had an executive from a company called Arcturus Therapeutics out of San Diego. I don't know if you're familiar with them. They're working on this, what they say is a one-shot vaccine, but they're starting testing in Singapore. I tried to press the executive, and he said, listen, we'll go to market when the regulatory agencies allow it. He said perhaps it could be, at best, at the end of this year, early next year. Is that a realistic schedule for a company that's starting human trials right now to have something actually reach market by the end of this year?
For a company that's starting right now that has no experience with vaccines or with the FDA, the answer is no. But for a lot of the large-scale programs that are underway now, Johnson & Johnson, Pfizer, BioNTech, AstraZeneca, and Oxford University, and others that are in deep phase 3 testing that have serious experience both in science and in the science of manufacturing and in dealing with regulatory agencies, I absolutely believe we can have a vaccine, or probably more than one, in early 2021.
In early 2021, but is that something that's going to be ready to be mass produced and actually will be available for people?
Yes. A lot of the companies that are now in deep phase 3 studies are also what's called manufacturing at risk. And that means that even before the phase 3 has proven these vaccines to be safe and effective, even before they've been given to the FDA for review, they're manufacturing millions and tens of millions of doses, so that if they pan out, we'll be that much further ahead of the game relative to rolling it out across the country and around the world. And if they fail, those doses have to be destroyed. But that just shows that everybody's got a lot of skin in the game here to make sure we can get a vaccine as quickly as possible and get people vaccinated as quickly as possible.
Some of these projects, you mentioned some. There's this one that's being done with Oxford University and with Moderna. I mean, where do you see perhaps the most promising breakthrough to come in really getting something that is viable, that's been tested, that's really ready to go?
Well, generally speaking, a vaccine takes up to 5 years to figure out, get approved, and manufacture. We're doing it in months. So, even early 2021 is, in fact, warp speed. My money is on the big programs by the big multinational companies, largely because they know what they're doing, and the science is very sound. The COVID-19 vaccine development ecosystem has some very interesting new technologies, but at the end of the day, you need to take those technologies and translate them into a vaccine that works, that can be manufactured, and that can pass regulatory muster.
Right. Peter, I have to ask you, because it seems like years ago, but I think it was months ago that I spoke to you about hydroxychloroquine that came up with a bang, and then there was a lot of skepticism and kind of the excitement down, and then for whatever reason, it seems to have bubbled up again as a topic of conversation, as a treatment, some claim an effective treatment for COVID-19. I mean, I want to get your feeling on hydroxychloroquine, and also why it just seems to keep coming up despite authorities saying it has not proven effective.
Well, the bad news is that science is hard. The last time most people touched science was in high school when there was a right answer and a wrong answer. Hydroxychloroquine is interesting because there's a lot of anecdotal evidence that shows that it's effective, but unfortunately the plural of anecdote is not data. A lot of the large-scale kind of classic science has shown hydroxychloroquine to be not effective, and in fact to be dangerous in some situations. But there's a big study right now, also out of Oxford University, to see if hydroxychloroquine can be a preventative. We'll see. I'm doubtful, but the science design is very sound. It keeps coming back because that's what science does. You fail, you fail, you fail until you find a solution.
Well, I guess I should point out there is at least one public figure in the United States that has claimed hydroxychloroquine can work as an effective drug against COVID-19, but perhaps we should just leave it at that for now. Peter Pitt, formerly with the FDA, thank you for joining us on The Rundown.
Thank you.